So I think one of the biggest problems is that there really have not been new drugs for children with AML really in the past 40 years. In the last 2 years, there have been a lot of new drugs that have been very exciting in terms of small molecule inhibitors or new immunotherapies, but they've largely been restricted to the adult population, and virtually none of these drugs are actually available to children. So I think that's been one of the major challenges. I think the second other major challenge is we have intensified chemotherapy to its maximal limit in our patients, and it has improved outcomes in the past several decades, but we really are at a maximal intensity right now where it just simply isn't possible to gain any more benefit from higher doses of these drugs. And these drugs are associated with really many short-term and long-term toxicities, both in terms of infection, low blood counts, and a lot of long-term toxicity in terms of children's heart function. I think that's one of the things that's really challenging is we currently cure about 2/3 of our children, but some of it comes at very high cost. We currently transplant about 1/3 of our patients in first remission, and that's obviously associated with short growth, sometimes endocrine dysfunction, infertility, which when you have 75 years ahead of you is a major deal. We also have problems, I think, in particular with cardiotoxicity. We know that giving high doses of anthracycline to our young children is essential for curing them, but when it comes at the expense of reduced cardiac output or even needing a heart transplant later, that seems like too expensive a cost for these therapies.